Has anybody ever asked you if you were grumpy when you're actually in a good mood? Or maybe somebody thought you were angry when you actually were quite happy. Well, if this describes you, it's possible that you may be suffering from the perma-frown. And if that is you, then I've got the solutions for you on this video. My name is Dr. Anthony Youn, and I'm known as America's holistic plastic surgeon. I help health-conscious men and women look and feel incredible using the right foods, clean skincare, and the latest in non-invasive treatments. And if you are going to consider actual surgery, I'll show you how to do it safely and holistically. And today, this video is all about reversing the perma-frown. How do you take that frown and turn it upside down? Well, this is something that is very near and dear to me because this is something that I suffer from and that my family kind of runs in my family as well. So I'm going to tell you about how to treat it, and there are a number of options that you have, and only one of them involves very minor surgery. So let's start by looking at this person. How do you take a frown and a kind of that permanent frown, otherwise known as the resting bitch face or bitchy resting face, and turn it into a more pleasant appearance? So the first thing we need to think about is anatomy. Why does somebody get a perma-frown? Well, this is a picture of me, and what I'm doing is I am flexing my depressor anguli oris muscles. And these are the muscles that extend from the corner of the mouth down, and it basically pulls the corners of the mouth down. So a lot of people, as they get older, those muscles can get more and more hyperactive, pulling the corners of their mouth down. And this is something that actually runs in my family. My grandfather on my father's side had it, my father has it, and I look in the mirror and I go, oh my gosh, I'm developing it too. So how do you treat something like this? Well, unfortunately, there's no cream that you can put on your skin. There's no laser treatment. There's no microneedling that's going to do anything for the perma-frown. You really have to target the muscle that pulls the actual corners of the mouth down, and you got to target filling in the lines. So let me show you how to do that. So if you're somebody like myself, you've got a little bit of a perma-frown, but it's not terribly severe, you may be able to treat it with some Botox and or filler. So if you take a look at this picture, this is me, and you can see I've got a little bit of downturned corners of the mouth, and I've got a little bit of a marionette line, more on my right side. The first thing to treat something like this is to try a little Botox. Botox injected about 2 to 2.5 units under each corner of the mouth in that depressor anguli oris muscle can weaken that muscle and can cause the corners of the mouth to actually lift up. If that doesn't quite do it, and it does it in most people where it's quite minor, but if that doesn't quite do it, then the next step is an injectable filler like Restylane or Juvederm. By injecting that filler into the marionette lines, which are the lines that come straight down from the corners of the mouth, we can fill those lines in and actually even provide support for the corner of the mouth to lift the corners of the mouth up. The great thing about these treatments, they're absolutely no downtime. You'll see the results for the filler right away. The Botox can take a week or so for it to work. The negative is this is an invasive procedure. It does involve needles, although in general it's relatively minimal discomfort when you're having it done. So we can get a pretty nice treatment for that when it's not that bad without surgery. Now you may be watching this video and saying, okay, Dr. Youn, the injections may work for you, but I've got it a lot worse. Well, if that describes you, then you may be a candidate for a grin lift, otherwise known as a corner mouth lift. So let me show you a picture of a person that you saw earlier. And this is a woman who came to see me who said, I'm working, I'm in my late 50s, and people think that I'm always grumpy. And no matter what I say or do, people think that I'm upset, and I just am not. And when you take a look at her mouth, you can see why people would think that. Her mouth, the corners of the mouth, they're turned down, and she's got these marionette lines. So the first thing I did with her is what we do to start out with, is I injected a little bit of Botox, and we did some filler. But unfortunately, it wasn't powerful enough to lift her corners of the mouth enough to give her that kind of pleasant appearance. So then what we did was a grin lift. A grin lift is removal of a tiny triangle of skin from each corner of the mouth. And by removing that skin and stitching the skin together, it provides a lifting effect of the corners of the mouth. And you can see a big difference here. The grin lift takes about 20 minutes. It can be done under a local anesthetic, and it's basically as simple as having a mold taken off from each corner of the mouth. It's that simple. The negative, though, like any surgery, is it does create scars. And the scars from the grin lift extend from the corners of the mouth upward. Initially, if you have this surgery done, you're going to look a little bit like Jack Nicholson from The Joker, which is a little scary when you think about it. But those scars tend to heal pretty well, especially the older that you are, the better those scars heal. And you can see a very nice result afterwards. Well, this woman came to see me and she said, Dr. Youn, I've got issues because when I go out to dinner with my friends or I go out to lunch, I get food and I get salad dressing and things that get stuck in these grooves extending from the corners of my mouth. So what I did for her is same thing. We started with a little Botox, we did a little bit of filler, but it just wasn't powerful enough to lift her downturned corners of the mouth and turn that permanent frown upside down. So we combined that with the grin lift, giving her a little scar coming up from the corners of the mouth on each side, and you can see a big, big difference and no worries about getting food stuck in those crevices anymore. And then finally, this is a patient who actually had a facelift done by a different doctor, and she said, Dr. Youn, my neck and everything is good, but I look so grumpy and people think I'm angry. So what I ended up doing is a grin lift. Remove that extra skin. She's got the little scars coming out from the corners of the mouth and a huge difference. Here she looks like she's angry and basically pissed off, and here she looks like she's pleasantly smiling. So you can get that, but unfortunately it is surgery. And the surgery has very minimal downtime, but you got to keep in mind those scars. Now, if you are interested in what injections can do for you, Botox, filler, check out this video right here because this video playlist is going to give you all the information that you need if you're considering any of these treatments.